to everyone. Trying to see who else is already joined. Oh, they did say that Mr. Mark Alexander, the president of rugby, is. Morning, Mark. How are you?
Morning, Minister. And I got a young honorable player, Minister, Joseph Dweber.
Oh, Joseph Dweber, good morning. Well, good to see you. I hope you guys are representing us well there. I'm sure you're doing us proud. Good to see you.
Okay. Thank you, likewise, sir.
Thank you very much for joining us this morning.
Thank you, sir.
Yeah. Mr. Mohale, we are in your hands when you are ready.
Good morning, Minister. Good morning, members of the panel. I see almost everybody's here. We are just upgrading our last panelist, Ms. Tifli, who's representing SANAC Civil Society. She's already joined, but now we want to upgrade her to be the panelist. In the next minute, should be sorted, then we'll be going live.
Do we have Dr. Moloi?
Dr. Moloi, in fact, was the first person to join even before myself.
Welcome, Doc. Thank you.
I see Steve has just joined. We almost what time now? It's almost 1 minute before 8.
Good morning. Good morning, Minister.
Morning, Steve. Morning. Good morning. Welcome. Thank you for joining us.
Thank you, Minister. Thank you, DM. Morning, colleagues.
Let's get
morning.
Let's get some voom. Yes. Vaccine, voom. Yeah, okay.
It's exactly 8 o'clock, Minister and members of the panel. We are going to officially start the media briefing. Are we all ready?
Recording in progress.
Good.
Yeah, ready for you.
Good. Good morning, members of the panel, the Honorable Minister, Deputy Minister, Dr. Dhlomo, Rugby SA Union President, Mr. Mark Alexander, Ms. Tifli representing SANAC Civil Society, and other supporting panelists, Dr. Glenda Gray from MRC, Dr. Linda Baker. I'm going to officially open this media briefing. My name is Foster Mohale. I'm responsible for media relations in the National Department of Health. We are going to quickly take you through the program of the day. The lineup, we're going to start with the Minister of Health, who's going to give us the keynote address as usual. Then we'll be followed by Ms. Litsike, Steve, who's going to give us the message of support from SANAC Civil Society. Steve Litsike is the Deputy Chairperson of SANAC. She's deputizing the Deputy President. So it's a deputy who's deputizing the President, okay, or co-chair. We're also going to get a message of support from SA Rugby Union by the President, Mark Alexander. Then we've invited Dr. Moloi to assist us to clarify certain issues related to the myth around the vaccine. So without wasting any time, I'm going to call upon the Honorable Minister, Dr. Joe Phaahla, to take to the podium. Over to you, Minister.
Thank you very much. Mr. Mohale, and good morning to my colleague, Deputy Minister Sibongiseni Dhlomo. Our senior management from the Department of Health, also to our guest panelists, Mr. Litsike, our co-chair for SANAC and also chairperson of the Civil Society Forum in the SANAC family, Mr. Mark Alexander, the president of South African Rugby Union, who's also accompanied by Mr. Joseph Dweber, one of our rugby players out there in Scotland, where they are representing our country. Thank you also to Dr. Ernest Moloi, who's agreed to join us on a very short notice to shed some light on some issues of myths which are keeping some of our young people away from vaccinating. And also we have the team from Sisonke leading the Sisonke project, Professor Glenda Gray, and also Professor Linda Gale Becker. Greetings to our media colleagues, Good morning to all South Africans, viewers and listeners at home. We are indeed pleased to be back to give an update to all South Africans on the progress we are making with the battle against COVID-19 pandemic. After just a short 2-week break from these briefings, after the tumultuous election campaigns and the actual election day. The last time we gave our update was on the 29th of October, just 3 days before we went to the polls. That briefing also included the Independent Electoral Commission, where they gave us a briefing on the readiness to have safe election. We are pleased to report that indications thus far, 11 days after the election campaigns, and also the 1st of November, which was voting day, thus far we have not experienced any super spreading side effects after the campaigns and the election day. We were assured by the IEC about the safety of the preparations for elections, but we did say that we were concerned about the safety of the campaigns by political parties. But thus far, not a single province or district has shown signs of a spike in COVID-19 infections. We continue to monitor the situation with experts from our National Institute of Communicable Disease and also from our COVID-19 Ministerial Advisory Committee. Over the last 4 weeks, the COVID-19 infections in the county have remained very stable, with daily infection rates keeping at a very low base of between 200 and 500 new infections per day. The number of active cases are still relatively high, even though much lower than when we were at the peak of the third wave. The positivity rate has also remained at an average of 1%. As of yesterday, we had still relatively high, just over 16,000 active cases, but quite a reduced number compared to the peak of the third wave. The number of patients in hospitals still remain relatively high, although again lower than at the peak, just over 3,000 patients remaining in our hospitals, with just over 270 in high care and just over 400 in ICUs, with just around 164 by yesterday on ventilation. The fatality rate has also gone down. As of yesterday, the reported deaths nationally for the last 24 hours were 17, which is quite low compared to the over 400, 300, 500 at the peak of the third wave. But of course, we still feel that the 17 deaths from COVID is still one too many. So at the end, we would want to see a situation where nobody dies from this pandemic. But these numbers are again a reminder to all of us that while the rate of infection is low and all the stats show that we are at the lower base, but the virus is still there and is still causing a lot of harm. As we have repeated a number of times before, a resurgence of infections which will introduce a fourth wave is expected. And as we can see in other countries, especially in some parts of Europe, there's reports in some parts of Germany, also on the world media, in the European, in the eastern side of Ukraine, you also see a lot of serious fourth wave infections in those areas. So our national team is working with provincial teams to prepare for the inevitable fourth wave, but we have to do everything possible to make sure that we can delay it and make sure even when it comes, it must have far less impact. The health facilities readiness in preparation for the fourth wave is addressing areas such as availability of oxygen supply, of which our bulk supplier, which is Afrox, has already finalized contingency plans for making sure that when the fourth wave does come, we do have enough supply of oxygen. Other areas such as bed capacity, also equipment, and also such as ventilators and other equipment, the personal protective equipment, and also other consumables, all these are receiving attention to make sure that we'll be ready which is expected somewhere in the middle of December or late December or even January. A major challenge is a retention of staff, as many of our additional staff employed for the COVID have been employed on short-term contracts. So this is a major area which we are also discussing with our National Treasury colleagues to make sure that we can receive additional funding to make sure we can retain the staff who are making sure that we can have enough capacity to look after the patients. We're also thankful that the World Health Organization is still retaining a technical team in our country, which is helping us in all these preparations. While no one can tell with certainty as to when this fourth wave will be coming, there is no doubt that it will come, driven by movement of people, but also driven by variants. So, and our genomic sequencing scientists are monitoring any variants of concern, but thus far they have not reported any alarm in terms of variants. They are always, they tell us that the mutations are happening, there's always variants being picked up, but the question is, are there variants of concern? And thus far they've indicated that not yet. The other contributing factor to the resurgence is going to be, as we know, movement of people. And we know that this is inevitable as we approach the festive season. And this makes it more urgent, therefore, that more and more people should come forward to be vaccinated, because we want everybody in our country to be protected from this inevitable fourth wave. Our vaccination program remains quite resilient, though facing ups and downs, thanks to a dedicated team of managers and field workers at national, provincial, district, and local levels, both in the public and in the private sectors. I can repeat today to say that we have enough capacity to administer vaccinations to all adult South Africans, and also residents and non-South African residents who are in the country. We can do this by the end of December. I know that some analysts have been criticizing to say that we will not be able to reach the 70% coverage, but what we can say is that we're doing our best to encourage South Africans to come forward to get vaccinated. But what we can assure everybody is that we have enough capacity to administer these vaccines to everybody who is willing to come forward to be vaccinated. Our teams in the provinces are taking vaccines to the people over and above the fixed vaccination sites. Thanks to these teams and the support we received from the IEC, we were able to administer just over 70,000 doses on the 1st of November during the election day, side by side with the voting stations. As we mentioned on the 29th of October, that we're going to have 1,000 mobile vaccination sites on the side of the voting stations. And this did happen, and for that we were able to vaccinate just over 70,000 on the election day itself. As of last night, when the vaccination stations closed, we had administered 23,684,000 doses. In terms of individuals who have been vaccinated, we are now standing at 15,808,000 of individuals who have been vaccinated, and this constitutes 39.75% of the adult population. So by Monday, the 15th of November, we'll have reached the 40% of the adult population coverage with at least one dose of the vaccine. 4 provinces are very close to reaching 50% of the adult population in a matter of weeks, and that is the Western Cape, which is at 48.2%, the Free State at 46.88%, Limpopo at 44.9%, and the Eastern Cape at 45%. If other provinces can start to pull up, we will be able to reach 50% of the adult population very soon. Full vaccination is just lagging behind the coverage at with more than 13,200,000 individuals fully vaccinated at 33.2% of the adult population. But as we start to use more and more of the Johnson & Johnson one-dose vaccine, we will be able to cover more full vaccination in the future, in the next few days and weeks. In terms of the age bands, we are quite advanced with the 60-plus population group, standing at 63.4% of the 60-plus who are vaccinated, very close to reaching 70%. With the 50-plus, we are standing at 57.4%, which means that very soon we should be able to reach 65%. The uptake by the young adults between 18 and 34 is worrisome, is moving very slowly. At the current moment, just under 25%, at 24.8%. It is clear that in this population of young adults, fake news and on the social media are making a huge impact, driving away, keeping away many of our young adults away from vaccination. And Dr. Moloi will address some of the myths which are being said when we talk to the young people. But we're hoping that as we get closer to the festive season, because they will be the more at risk with a lot of social and entertainment activities, we hope that many more of our young adults will come forward. On the 12 to 17-year-olds, who we opened for a few weeks ago, just over 250,000 to be definite, 252,934 have already been vaccinated by yesterday, with just over 350,000 registered on the EVDS system. We thank the parents and guardians who have made it possible for these young people to come forward and receive their jabs. And we are hoping that as we move into school holidays, more and more will come forward to be vaccinated once they finish their exams and they go into school holidays, before they can go out and visit family and friends during the festive season. As we mentioned previously in our last briefing, the Sisonke 2 study of Johnson & Johnson boosters for health workers, that we mentioned that it would start. This has now started. And thus far, 83,769 health workers have registered and given consent to participate in this in the Sisonke 2 study, which will be administering booster doses of Johnson & Johnson. And out of those, just over 9,000 have already received their booster doses. We are hoping that all the 500,000 health workers who received the Sisonke 1 will come forward to participate in the Sisonke 2 study. The results of this study will give us a better indication of the role of booster doses, how much immunity was waning, if so, and how much additional strengthening of the immunity will happen with the second with the Sisonke 2 booster doses. Professors Glenda Gray and Linda Gale Becker, who are on the platform this morning, will be able to shed more light and answer questions on this matter. On the vaccination certificate side, it is running very well. More than 3 million have already been downloaded by those who have been vaccinated for use for various purposes. The technology and solution for the QR code, we did say when we started that this will be further improved. The technology for the QR code verification will go live next week. This will allow third parties to verify the validity of the certificate by scanning the code, the QR code. This weekend, starting today, has been declared as the second Vuma weekend. We know that we had our first Vuma weekend at the end of September, beginning of October. So this is the second Vuma weekend declared by President and Ramaphosa and Deputy President Mabuza. So all cabinet ministers, deputy ministers, premiers, MECs, and all public reps are expected to go out to motivate members of the society out there to come forward to receive their vaccination. The message is very simple. The message is that if we all vaccinate, we can have a safe and enjoyable festive season. Unlike what happened last festive season, we know that in December last year, December 2020, and early January this year, 2021, we did not have a very good festive season. We were deep into the second wave with many people very sick in hospitals, our health facilities were being overwhelmed. At this time, we had to close beaches and other areas of entertainment because the overwhelming nature of the second wave. So we're saying that if many South Africans can come forward to vaccinate, we will be able to make sure that we can save our country from this challenge. So we call on all South Africans to heed the call for the Vuma call and come forward and be vaccinated. Thank you very much, our facilitator. That's my update to the nation this morning, and we can proceed.
Thank you, Minister, for your keynote address and update as far as vaccination is concerned. Indeed, the issue of myth around the vaccine is a concern to us because it drives people away from taking this life-saving jab. So I'm going to allow Dr. Moloi, I'm going to give him 5 minutes just to clarify if there's any relation between the vaccine and infertility, because a number of people that are saying they can't take vaccine because of the myth around the issue of infertility. So I'm going to allow Dr. Ernest Moloi to just to clarify the issue from medical point of view. Is there any link between vaccine and infertility? Dr. Moloi.
Good morning to the panel and good morning to the minister as well. I think that the minister put us into a situation whereby we understand where the country is, which we are worried about. And before, I'll just briefly talk about the myth which actually come from December 2020. The first one probably comes from the social media, where there is a concern really from social media that if I take this vaccine, will it affect my fertility or not? The other issue related to this, there is also some of the, especially developing countries, who believe very well that probably this vaccine is meant to actually depopulate the whole world. That is a movie story which appears. And the third myth actually comes from most of the socialites or people who know, who are public most of the time. Then especially that the vaccine can affect men based on one issue that in the country, that they saw a man after getting vaccine then had to have a testicular problem. But that was researched and nothing like that. Now, there are two prongs which I want to talk about of how we should approach this problem from fertility point of view. We know that there's a study which is done in men, young men, by that is people between 18 and 35, which are in the reproductive age. And in that study, the myth that the vaccine or antibodies may interfere with fertility of these people. And 3 things were done. They look at the sperm count of the person before and after, and after getting the vaccine. It was found out that doesn't affect 3 factors. That is one, the volume of the sperm, the concentration of the sperm, mobility of the sperm. It wasn't affected. That's a recent study which has been done, and although the number is still very small, it wasn't consistent. Based on that, we do encourage that. However, these young people, if they don't take the vaccine, there's a bigger chance that it can indeed affect their fertility. It can affect their testicular production of sperm. There's also papers now are coming where we're checking the impact of vaccine in young men and showing that there may be a problem. The same mechanism whereby we know that COVID-19 causes thrombosis and therefore it can cause a bit of thrombosis in the testicular arteries and veins and actually prevent these people.
Doc, we are losing you. Dr. Moloi? We seem to be having a problem, Dr. Moloi. Maybe we'll need to... Dr. Moloi, are you done?
No, he was still speaking, but I think the network, unfortunately, looks like experiencing network problems.
Okay, maybe we can proceed with the program. We can, maybe during the time of questions and answers, can be able to come in and clarify some of these issues in the best interest of time. Thanks, Doc, for the inputs. We'll bring you back again during the time of questions and answers so that we can be able to clarify some of the issues, because we understand the issue of connectivity. According to my program, we are supposed to take Steve Lisike on behalf of SANAC Civil Society. However, I've been requested by Mark Alexander, the president of SA Rugby Union, that the player who's with him, Joseph Dweba, is supposed to join other players in the training in the next 10 to 15 minutes. So I'm going to swap the two items. So I'm going to call upon Mark Alexander and Joseph to give us the message of support as far as the rugby union is concerned. As we know that other sporting codes like soccer, they've allowed about 2,000 vaccinated fans to come and watch the game. So want to check as far as the rugby union, how ready are they to allow the vaccinated fans to also to come and watch their beloved soccer, rugby club. So over to you, Mark and Joseph.
No, thank you very much. I think as citizens of South Africa, we have the responsibility to join the fight against this devastating pandemic. And the most effective way we can do that right now is to ensure that all the adults are vaccinated. We believe that government cannot fight this pandemic on its own. We know that we are stronger when we work together. And that we're all looking forward to enjoying a life as normal as possible. Being vaccinated protects not only ourselves, but our loved one and our community.
The Springboks are proud to have been vaccinated. They care about their lives and about the livelihoods of South Africa. Join the winning team, get vaccinated, and encourage people in the country to get vaccinated too. We would love to have supporters back in our fields again.
Let's preserve lives. Thank you, Facilitator.
Thanks, Mark Alexander and the player. We believe that you will use your influence to encourage your friends and other rugby players to do the same, because it's our collective responsibility as all sectors of the society, soccer, rugby, cricket, and everybody, to make sure that everybody is vaccinated, because until majority of us are vaccinated, we are not safe. So I'm going to thank you for that, and all the best in your journey and sports in Scotland. Thank you.
Thank you so much.
Thank you very much. Thank you from my side. Thank you to Mr. Alexander and Joseph. Thank you very much.
Thank you.
Okay, thanks, Mark. Without wasting any time, I'm going to call upon Ms. Steve who's representing SANAC. He's the deputy chairperson and co-chairperson of SANAC. She's also wearing another hat.
Foster, maybe should we not allow Dr. Moloi just to complete, because he might be also under a bit of pressure. I'm just thinking, apology to Ms. Steve. Could you just allow Doctor, I see he's back on the line, if you could just maybe take his input further?
Okay. Yeah, no, thanks, Minister. Doc, can you finish? And also, I think the issue of the speaker on your side was not coming all right. So maybe if you can go closer to the mic so that you can be audible enough. Doc, over to you.
Can you hear me now? Thank you. Yes, I was trying to say the myth also on the female side.
Yeah, network seems to be a serious challenge on
maybe
one side.
Can we ask him maybe if he can switch off the video?
I think that can work. Doc, can you just only switch on your mic and switch off the video? Maybe that will be clear. Dr. Moloi? I don't even see him now on the
I think it's frozen.
Frozen. Yes, I can see. Maybe let's proceed. If he comes, we'll decide to. If now it's been off the list, so he disconnected now. let's proceed in the meantime. We'll check with him if he has got enough time on his side. We understand he's busy, if he can be able to come back and continue. So now I'm going to call upon Steve Lisike, is the Deputy Chairperson of SANAC, is the co-chairperson along with the Deputy President, Mr. Deputy Mabuza. She's also the chairperson of Community Constituency France, so she's wearing many hats, but today she's here in a capacity as the chairperson of Deputy Chairperson of SANAC, representing SANAC Civil Society. So she's going to give us the message of support. We work closely with SANAC Civil Society on other issues, the HIV, the TB, the STIs, and the like. So even this time, during this time of COVID, they join hands with the government to support the government. Over to you, Steve.
Thank you so much, Program Director. Thank you, Minister of Health, Dr. Joe Phaahla, Deputy Minister, Dr. Dhlomo. Of course, Mark has just focused on other responsibility as the President of South African Rugby. Fellow panelists who are friends, comrades that we work with, thank you so much. And to everybody who has joined this morning. Minister, thank you, and to South Africans who are viewing. This is much more important space to interact, to reflect. As we know that COVID has really presented a crisis for all of us across the world. You know, as the pandemic kept on spreading, people rightly, you know, across different sectors, business, government, and civil society, stepped up to the challenge and made sound protect lives and livelihood of people. So I think that's a fundamental point. We've seen the leadership provided to strike difficult balances between preventing the spread of the virus, temporarily limiting freedoms, and enabling people to fulfill their own essential needs. And we've seen these were such difficult decisions. And I think we run a risk, of course, as the minister has said, that, you know, if we are prepared, as we have been in the past. We've gone through wave 1, 2, 3, and now towards wave 4. We have to be prepared. Now, Minister, as you know, that SANAC has been in the forefront also with its own constituencies, whether the health professionals, the researchers, you know, communities, faith-based traditional leaders who have worked as community constituencies in different auspices to respond to the pandemic. And I think it's one thing to be appreciative that, you know, time and time again, in the face of challenges, civil society adopted a can-do mindset, mounting a positive response, you know, that is really characterized by flexibility, creativity, and innovation. Civil society across the country deployed staff, volunteers, everywhere, you know, financial resources to serve the urgent needs. And of course, while that needs to be strengthened in many ways, but civil society normalized, which is in the normal setting, the advocacy and priority, but also responding to the rights priority in this manner, but also provided essential supplies, services, including food, healthcare, cash support, help sustain communities in many ways. And that is the kind of resilience in numerous ways that civil society has done. What community constituency COVID-19 front also did was to also enable neighborhood and set up neighborhood agents, street agents, working with sectors, working with provincial leaders, district leaders, local leaders, to really ensure there's mutual help, there's mutual quick formed and tapping into the local resilience. And those are the kind of things we need to be strengthening and supporting as ongoing, as we're going towards the fourth wave, but most importantly, in the response of this vaccine. Why it's that important is really to ensure people, South Africans, those in South Africa, are resilient and are also taking an uptake on social behavior change. And that is quite critical. Our commitment, you know, has stemmed from the beginning. On the 23rd of March 2020, when the president announced the lockdown regulation, the community measures were adopted. The strategy was developed. with the pillars that stem. And when civil society stepped in, those pillars included the leadership that from your office, from your ministry, there was a setup of the Ministerial Advisory Committee on Social Behavior Change. Civil society stepped up. There was coordination of civil society. There's been a vaccine literacy education that has been rolled out across the country. So the representation of voices, the social mobilization, communication, public awareness and advocacy continued. And right now we are even mandated with the vaccine agenda that we are focusing on. But one thing that is key, Minister, and also guests who are joining in, we have to ensure that the vaccine agenda, our approach towards the vaccine agenda is premised on two areas. One, how we advocate for an end to vaccine challenges through raising our voice. One, on access, and the access that is equal and equitable to everybody in rural, urban, township, peri-urban areas, where no poor, no rich can just be in or unequal in many ways. And this is really also about what we've seen globally around the TRIPS waiver. Here in South Africa, we have vaccines, but the uptake is not as the way we wanted to see. And this is why we stand even with the Vuma campaign that the activation, non-stop activations must continue in making sure that uptake is happening. And I think South Africans must take this seriously and not take it lightly. Countries, our neighborhood countries, are struggling to get their hands on vaccine. People are in need of vaccine, and we are not supposed to take this lightly. The second element is really about how we promote the education and still continue with the advocacy within the general public, where people still understand the importance of vaccine itself. Now, 6 critical points, and I'll just be very brief on that to save time for interaction, Minister. We will continue to join the hands with government and other stakeholders to massify the effort, to thrive against COVID-19 with the principle, until we are all safe, no one is safe. And I think our campaign, I am, you are, we are together in ending COVID, signaled that as community constituency and civil society, but also increasing our effort to engage with South Africans and those in South Africa to vaccinate, least complying with also the non-pharmaceutical interventions. We cannot take advantage on the non-pharmaceutical interventions that are needed. The mask, the sanitizing, washing of hands, keeping social distance, but also ensuring adequate ventilation where we are and everywhere it happens. Of course, our commitment also includes what we recently did over the weekend. This past weekend, we launched the effort engaging with men from different sectors, men who are in the taxi industry. We engage with men in the traditional leaders, traditional health practitioners, men in the faith sector leaders, men in the LGBTI sector, all men in all society, which we engaged when we were supported by Solidarity Fund on the roll up your sleeve, and also make sure that vaccination for men is adequately addressed. We know men have got a low health-seeking behavior. That must change. Men have to take responsibility and not shift that responsibility elsewhere. We need men to vaccinate because they are key to achieving this. Now, the other key points, which are last few points for me, when we use all efforts to ensure that we support the Vuma vaccination champion so that we reach the target of 40 million South Africans vaccinated by taking one another daily to win the hearts and minds of those, it is of course in no doubt that we have to champion this collectively between civil society, government, and business and other stakeholders. Minister, one key issue agenda where we want to emphasize HIV and TB agenda remains critical. It has not been parked. It has not disappeared because we are facing the COVID-19 crisis. Of course, HIV has been integrated in the last, when we started the responses in the country, but we want to emphasize we've lost quite a number of people on treatment. We have also lost the number of people uptaking and being initiated on treatment. So we really want to request an advancement of integrated effort to address HIV and access to ARVs even during this time. We also want to emphasize TB is one of the key challenges in South Africa. 200,000 missing cases is still a big agenda for us. So we have to see that COVID-19, HIV, TB are integrated health, and they are a public health agenda. We are excited, Minister, with the health workers and the frontline workers who will be receiving the boosters that has been announced recently. So we want to congratulate the Department of Health and all key stakeholders on this effort. And we want more communities and more people in South Africa to vaccinate. So the importance of community measures remain fundamental for us as communities, as civil society. We want not only just to look at when we pass through this phase, we want to make sure that everybody has stepped up and has stepped in to wage a war to triumph against COVID and also triumph against all the other pandemics. We happen to be the ones who will be counted as civil society because we did not shy away. We then rolled up our sleeves and we remain committed. We want government to also sustain the support to civil society. Domestic resources, when they are redirected, don't forget to support communities everywhere, in provinces, in district, and in local level. It is our responsibility to make sure that collective effort and the right use of resources go to where it's needed to benefit the beneficiaries. Minister, we roll up our sleeve. We commit ourselves as the civil society in SANEC, civil society in NEDLEC, as community constituency have come together to respond. Thank you so much for this opportunity.
Thanks, Steve, for that commitment and assurance that SANAC civil society will continue to support the government in this fight like you have done against HIV, TB, and other conditions. Thanks for that assurance, and we are together in this. Before I call upon Professor Glenna Gray, I'm going to try to give Dr. Moloi one more chance to finish his story. I've received feedback from media people through my WhatsApp that they are interested to hear from what was said, but unfortunately the sound and the connection was a barrier for them to receive the story. Dr. Moloi, I'm going to allow you to finish the story, but I will request you to switch off the camera and only talk through your microphone and be closer to the mic. 3 minutes to summarize the story, Dr. Moloi.
Okay, yes, what I was talking about is actually the impact of COVID-19 vaccination on the people, of a female side. A very important thing, which I can say, I just want to elaborate that there are a lot of studies which have checked, and the message is out, is that if you want to have a baby or you need to go through a fertility treatment of some sort, it is better that you have a vaccine before, a COVID-19 vaccine, which will help you so that you don't have problems. As pregnancy, we know it's got a lot of problems if you are pregnant and you're not vaccinated. Last year, we have confirmed that people must actually, who are pregnant, go and vaccinate for 3 reasons, basically. When you're pregnant and get COVID-19, you're more likely to have a serious disease. Secondly, you're more likely to be hospitalized. Thirdly, you're more likely to end up in ICU, and your baby as well is more likely to born, before time, premature. And on our studies as well, we have seen that, female who are pregnant or women who are pregnant are more vulnerable, that the mortality is very high. Now, if you are a female and you're pregnant and with other comorbidity, like, weight, hypertension, diabetes, and so forth, you are more likely to end up in an ICU, which will be actually difficult for you. Then we said it's very important as a fertility specialist and all the, the organization of
fertility. By that I mean, what is it? ESRA. By that I mean SASREC. By that I mean World Health Organization and CDC promote that we should be able actually to give this patient vaccine before we can start the program of fertility, either ART or if patient want to be pregnant, normal with no everything, it's better that you should take the vaccine. Now, what happens when you have the vaccine and then you fall pregnant before you get your second dose? The advice is that go and get that second dose so that you can, be protected and have immunity throughout. I think I'll stop there, Chairperson.
Thanks, Doc, I think now you were loud and clear and visible enough. Thanks. I believe the media, the general public, they understood your message. But if they feel that they need more, we can still try to see how can we bring you back in future or get more information that we can share with the people to empower them. Thanks. We can switch off the camera for now. Now I'm going to call upon the president of MRC, South African Medical Research Council. She is Professor Glenda Gray. So it's rare where we can have two presidents under one roof. So today we brought two presidents, President Glenda Gray and President Mark Alexander. So over to you, Prof. Just elaborate on what Minister has touched on as far as Sisonke Trial 2 is concerned. Thanks.
Thanks, Program Director. Good morning, Minister of Health, Deputy Minister of Health, and the fellow panelists. Prof. Linda Gale and I will do a tag team. We won't be long, but we just want to say that as soon as the results of the second dose of J&J vaccine trial came available, that showed that the second jab was as effective as 2 doses of the J&J, was safe, and also had good immune response as well as durability. We worked together with the Department of Health and J&J to try and evaluate whether we could bring in a boost for the healthcare workers in South Africa. We want to do this before the next wave. We've got a very limited opportunity. We've got a very limited time. We've got up until the 15th of December to vaccinate almost 500,000 healthcare workers, and we hope people will start to come through. We've been very happy to see so many registrations, and we will scale up next week to make sure that we can reach our goal of vaccinating these healthcare workers before the 15th of December and before we go on holiday. So Linda Gale, maybe you can just talk about the sites where we are, but just to say that we want to appreciate the hard work of the Department of Health, and we also want to appreciate the hard work of our fellow Sisonke team members, our scientists who are going out now into the various regions all over the country to vaccinate healthcare workers. We're also very excited because we have very good data, we have good safety data, we have good effectiveness data, and we have good immunogenicity that shows that the second dose of the J&J vaccine is durable. So we're very excited to give a science-based, evidence-based boost to our healthcare workers.
Thanks, Glenda. I'll just say that people may remember Sisonke 1, we had to start very slowly in just 18 sites. The good news is with Sisonke 2, because of all the experience of the national rollout to date, we're starting in all 9 provinces in up to 400 and more sites. So in every district, there should be an opportunity to receive Sisonke 2 boost for those individuals who were in Sisonke 1. And as Glenda says, we don't therefore expect the queues that we did see before, but there is a limited time offer for this. And so we want to encourage our colleagues to move quickly to get their vouchers downloaded and make sure that they get to the sites they need to get to in order to get their boost ahead of that 4th wave that Minister was speaking about. Importantly, you can look on the Find My Jab site to see which site is closest to you, and again, encourage you. Thereafter, if there are any concerns, please call the Sisonke Safety Desk on the 0800 number, and we will help in any way we can. Thank you.
Thank you, Pastor.
Thanks to the 2 professors, Professor Linda Gale Baker and Professor Glenda Gray, for the additions on Sisonke. So, Minister, I'm going to now take the questions almost 10 minutes to 9. I'm not sure if you want to add anything before I take the questions, Minister.
No, let's go straight to the questions.
Okay. Yeah, I've received a number of questions through the WhatsApp and through the line. I see. Let me start with the first question by Misi. Can one kindly share the links or research topics for teratogenicity of the vaccines and the study for effectiveness of the vaccines in reducing severe morbidity risk? My interest is on methodology of studies. So I think the two professors can be able to answer this one. The question is available on the chat, colleagues. So I'm going to Ms. Pauline. Can you switch off the video for now? Ms. Pauline? Ms. Pauline, can you switch off the video for now? Okay, while it's still time to switch off the video, I'm going to take to the second questions. The second question is, if one is fully vaccinated and has got this certificate, is it necessary, is it a requirement for South Africans or for one to conduct a COVID-19 test when entering the country from neighboring countries like Lesotho, Swaziland? So is it necessary to, if we are vaccinated and we got a certificate, is it still necessary to do the test when we enter the country? And which countries has South Africa entered into agreement in order to accept our vaccine certificates? The other question is, what is the government going to? Why do the healthcare workers need to consent for Sisonke? Unlike while we know that we say there's no need to consent for the national vaccine rollout program. Why do we have a need for consenting while we say there's no need to consent? The second one is, when is the government going to introduce the booster shot for the rest of healthcare workers who receive their vaccine outside Sisonke and the general public? I know the minister and both the professors, they've touched on this, but if they can elaborate this again. The third question is, we've talked about the Vuma Vax CHAMP program, so they need the clarity on this. How does it work? And what are the benefits of this Vuma Vax CHAMP program? We have accepted Pauline Maketa, who's going to answer this question. So I'm going to hand over to Minister and the rest of the panelists to share these questions. Minister?
As you said, the first question will go to our to our Sisonke team, Professor Glenda Gray, and the team. You can deal with the first one. Professor Glenda Gray.
Sure. Yeah. Sure, Minister. Before any vaccine goes into a human being, there are preclinical studies on teratogenicity and on reproductive toxicity. So before a vaccine can even get into a human being, there are extensive studies done in animals that have been well validated and are accepted at a global level. All this data, all this preclinical data on teratogenicity and reproductive toxicity is available to all the regulatory authorities. And if you go onto any website of the CDC or the FDA, you can see the whole dossiers that explain these this data. And we're also reassured that the platforms that we have been used for other vaccines, and also those same preclinical testing and teratogenicity has been done in that, and also has shown that there is no way that these vaccines can cause sterility, can impact on women's ability to have babies. And we are reassured both by the preclinical data and from our own experience. There are studies in pregnant women, and there are studies in the field about having women who are pregnant having the vaccine. So we're very reassured both from the preclinical data in animals, the human data in studies, and also the experience in the field, that these vaccines are safe, they don't cause impotency, and they don't affect your ability to have a baby. In terms of the Sisonke consent, we are consenting for this. We are asking healthcare workers to consent to this because we're trying to establish how we will move the boosting strategy forward in South Africa. And to move a boosting strategy forward, the government requires evidence. And so our job as the Sisonke team is to provide government with a very important evidence about how good these vaccines were in the field, and what is the timing of the vaccine. Obviously, the longer we can space a J&J jab from the time you first get it to the time you get your second one, it's better for us in terms of being able to spread out the vaccine. We know this vaccine is durable, and that is why we'll be able to tell you from 6 to 9 months post getting your first vaccine how well these vaccines work. And so healthcare workers will consent so that we can use their data to show the government the effectiveness of this, and to help them make good decisions about doing the next boost for those who've got the single dose J&J in the past. Based on this data that Sisonke we get, this will help the government inform how to do booster shots in the future. And so it's very important for us to get this data to the government by the 15th of December to get our boosting shots, so we can give good advice to the government. In terms of, what was the last question that we had, LGB? So I can't read my handwriting now. I think I lost that last question, Foster. Let me just look. What was the
Linda, I think the question maybe we can share was the one to say the rest of the health workers outside Sisonke. Yeah, I think you could. But I'll also add after you. Yeah. Yes.
So the next wave of healthcare workers got the 2 jab Pfizer, and so there is time for the next wave of healthcare workers who got the 2 jab Pfizer to evaluate when to give them the subsequent boost. And so we're concentrating on the first group of healthcare workers that got their vaccine between mid February and mid May, and giving them the first access or early access to a booster to help inform the future. And so as we move along in terms of the year, we will be able to evaluate who should go first. So the people who got the vaccine first are the people that should get the booster first, and so that we can evaluate in a sequential way with evidence, and be able to make sure we give the government the right evidence for the booster shots.
Thank you very much. I don't know if Foster is able to come back. He was frozen.
No, yeah, Minister, I'm back. You can make some additions.
Okay, maybe let's allow Prof. Linda Gale Becker if she wants to add something on that, and then I'll also say something.
No, thank you, Minister. I would just say people asked specifically about the designs for the preclinical. I would just say that all of that staged research and development for the vaccines followed a very regular process. So these designs are tried and tested. They've been used in all kinds of drugs and all kinds of vaccines. And as Glenda says, those are all available online. They are public documents. SAPRA also considered all of that data before considering these vaccines for use. And I think it is an important question, and it's important to reassure the public that no corners were cut in getting these vaccines, although everyone's concerned that it was done rapidly, and we're grateful it was done rapidly. There were no corners cut in this regard. So I think that's really important to reassure. Otherwise, I'm in full agreement with what Glenda said this morning. Thank you.
Thank you very much. I can also just add to say that indeed the Sisonke 2 study will really help us in terms of planning our next phase of boosters. We would want to also make it available for other health workers outside the Sisonke trials. It's just that also in terms of confined a group with a very clear information, the Sisonke 1 provides that very clearly. So as that study continues, from the department side, we're receiving a lot of inquiries about health workers who, as Professor Glenda Gray said, were on the Pfizer. We're working on that to see to it that as the Sisonke 2 trial continues, of course, especially those who got the Pfizer, the same process. I mean, we will need to get approval from the regulator, from SAPRA, in terms of the data. At the current moment, Pfizer is approved for a 2-dose. So if we're going to have a third dose, that would also have to go through some regulatory approvals. So, but all that is on our table, together with our good, professors here. We are looking at all those, and when the time is, when we are ready with all those, together with approvals from SAPRA, those announcements will be made. I think there was a question, Foster. I'll leave that to you on the Vuma Vex Champ. I think Ms. Maketa was going to deal with that matter. Over to her, and back to you, Foster, after that.
Okay, thanks, Minister. I'm going to allow Ms. Maketa to clarify the issue. As we know, as the Minister has already announced that today we are also launching the Vuma Vex Champ. So just to explain, what is this Vuma Vex Champ program and what are the benefits? Over to you, Ms. in 2 minutes, Ms. Maketa.
Thank you. Good morning, Minister. Good morning, Deputy Minister. Good morning, all panelists. We're coming live to you today. Minister, thank you for being part of allowing us to launch the Vuma Vex Champ. The Vuma Vex Champ, Minister, is where we're requesting for all South Africans to become part of being a champion and an ambassador to say that we actually want to assist our country in understanding the vaccination process, and also to join hands with the Department of Health in getting people to get vaccinated. And how can we do this? We are saying that together we can educate ourselves as the citizens of South Africa. We can promote vaccination to our friends, our families, our circles where we live in, and people that we engage with on a daily basis. And we are also saying that as community, we can then jointly report issues that are not clear to our communities and problems that are also coming up within our communities. We can jointly report such on posts through social media, and also the platform of the National Department of Health and the COVID WhatsApp system. And there is a number that you can dial, and the number is 0600123456. That is the key word, will then be join the Vex Champs. You can also become a Vex champion by joining us on www.vexchamp.org.za. And you can also call the National COVID Hotline on 0800 029 999. By doing all of that, you can then assist us as the community, from the older to the youngest person, to be part of our Vex champions in order for us to spread the word. And we are saying that there is strength in when we do these things together. Let's all be part of actually crushing the fake news and promoting what is good for our health in order for us to save our country and have a better summer. Vuma Vex Champs, come on board. We're waiting for you. Thank you, Minister.
Yes, Ms. Maketa, indeed, Vuma, all of us, we will try to make sure that we publicize all these platforms, all the information, because only when people have got information that they will be empowered to make the right health choice. Thanks, we can switch off the camera and we'll try to publicize all the channels, the platforms, through all the social media, the print and the likes. Thanks for that opportunity, and all the best. And we are going to join the Vuma to be the Vuma champions and ambassadors of healthy lifestyle. Thank you. So, Minister and members of the panel, we've got the last batch of questions. I know in terms of time we are not doing well. I'm going to, in order to not fight with the members of the media, I'm going to take this last few questions so that we'll be able to answer them. Then the rest will be able to deal with them outside this media platform. So the first question is from a number of questions from Christian Duplessis. The first one says, if vaccines are effective, why is infection in Europe currently so high? Second one from the same journalist, do you have statistics for how many breakthrough infections are there in Europe? So these are more on European issues. The third question is, do we have more clarity yet on how long vaccines will offer protection against serious disease and hospitalizations? I believe the professors will also assist to address this one. What are your predictions for the fourth wave of infections in the country, and when will it start and end, and how big will it be? The fourth wave, I think Minister has touched on this, but he can also try to elaborate on this with help of professors and other members of the panel. The fifth one is, why is booster dose not on the cards for the general population? I think this one, you don't have to answer this one, Prof. We already touched on this one. There's other questions from Anastasia Mukovu from Chakaranda FM is, with J&J booster shots, we understand that it's only for healthcare workers. Do we have enough to cover the general population? The priority is going to be the civil servants. The question is directed to Prof. Gray. The last question from ENCA as follows. This one is more directed to the department. The first one is, the ACDP and community organizations are trying to get governments roll out vaccination to minors bolted. If the party is successful in these efforts, will this be detrimental to government's efforts trying to protect as many young children as possible against COVID-19? I know this issue is currently beyond the course of law, but Minister will advise whether is it answerable or not. The second question from ENCA or ETV is, will the booster shots be available for the 60+ cohort, and how many months after how many months is it advisable for people to get the booster shots? Minister and members of the panel, these are the last batch of questions. Over to you, Minister.
Thank you very much. Thank you, Foster. Maybe let me just go back to a matter which I didn't deal with very quickly, of the certificates and acceptance across countries, whether you still need a test, for instance. I just came from a SADC meeting in Malawi yesterday, and I can report that I had to have a PCR test before leaving South Africa, and another PCR test before leaving Malawi, coming back. So the reason for that is that countries have to first reach an agreement on recognizing each other's certificates. So because this is still new and developing, even from our side, we had not yet even started to negotiate with many countries, because of the fact that as we said when we launched the certificate, that it still needed a lot of improvements. So as I mentioned this morning, one of those improvements have already been achieved in terms of activating the safety of the QR code, which can now be scanned and verify information. But there is furthermore security features which will be enhanced during the course of this month. So as those security features get improved, we will be negotiating. We have already also been approached by some countries to recognize their certificates. So countries and also in terms of multilateral bodies like SADC, Africa Union, and G20 and BRICS and all those neighbors, we will all be discussing in terms of recognizing each other's certificates, but you have to submit information to whoever you are speaking to show the safety of your certificate, the fact that it cannot be easily be defrauded. It can't be, you can't produce a fraudulent certificate easily. So those are the things which we are starting to discuss with various partners all over the world. And only when that is finalized, then hopefully even the testing can be waived. But at this stage, some countries require both the certificate and the test, and then you are excused, for instance, from quarantine if you can produce both. And so this is work in progress. In as far as the ACDP matter, let me just deal with that quickly. That matter went to court, I think, a day before yesterday, on Wednesday. The matter was in court. and the court actually dismissed the matter as not being urgent and said that the ACDP can approach a normal court, that there is no urgency on the matter. So at this stage, it is not the merit of the case have not been debated in court. But we are very confident as a department. We have prepared, our legal team have prepared very well. We have given them adequate information. Thanks also to some of our medical specialists, our research people and epidemiologists and people very well informed in vaccinology. We have received a lot of good information to back up our fight against that. In fact, well, of course, if the ACDP and those who are with them can win in court, it will be a major setback, because it will mean that our young people below the age of 18 who also are susceptible, as we have seen, are susceptible, and some of them do get seriously ill. If they were to win against the department in that regard, it will deprive young people of this protection. So we're going to do everything to fight against this. I will leave, in terms of the fourth wave, which you have mentioned, I will invite also our medical team to also venture into this. Nobody can really adequately, with certainty, predict when the next wave is going to come. As I've mentioned, it depends on mainly two issues: the variants, if there's going to be a variant of serious significance, a transmissible variant. So at the current moment, the scientific team which is monitoring this have not as yet detected a variant of concern, which is a variant very significant and transmissible one. Secondly is the movement of people. The more there are crowded and movement of people, the more you're going to have the fourth wave coming. So those will be the factors. At this stage, we don't know when it's going to come. Let me, Foster, let me leave the other issues. Boosters for over 60s. I'll also invite the team to comment on that. At this stage, as we've said, we're starting with the Sisonke, we're looking at the data, and as more information, and all over the world as well, there's a lot of work being done, to check whether how the immunity is going to last, whether these boosters are going to be required. We have already announced in terms of categories of those who, for medical reasons, will need a second or third dose, depending on whether they had a 2-dose Pfizer or 1-dose J&J. We've already announced, for instance, people on chemotherapy, on dialysis, and so on, autoimmune disease, on steroids. All those we have already authorized on the prescription of a doctor that they can get their additional doses. But in terms of the general population, there's still a lot of work which is being done. And of course, once including the Sisonke 2, once that is completed, we'll again use the risk-adjusted approach. But let me leave the details to our team, our scientific team there. Foster, let me maybe pass over to Prof. Glenda and Professor Linda Gray.
Yeah, thanks. These are beautiful questions, and the question about the resurgence in Europe at a time where Europe is highly vaccinated, and it's a combination of things. As the Minister said, there may be some waning immunity, and there may be new variants that are emerging. But the important question to ask, even if there is a resurgence in Europe, is the hospitalization rates down and are deaths down? Because we know that vaccines work against protecting against death and against hospitalizations. And so if we see breakthrough infections, then normally it will be mild to moderate. And so even though we are seeing resurgences in Europe, we expect to see that there are a reduction in deaths and hospitalization. And that's the litmus test about the vaccine. These vaccines were designed to protect against hospitalization and death. And we will see mild infection and breakthrough infections. And so we need to watch that. And I think that's what's important. And the waning immunity may impact on it. And that is why some of the the northern countries who started very early are giving booster shots to their Pfizer or Moderna shots. So I think that's important to do. And as the minister said about the boosters, so we're going ahead with the J&J booster for our healthcare workers to inform future rollout of the boosters. And I think that's very important, particularly if we are going into a fourth wave. We do need to protect our healthcare workers. And this data that we get will show us how to time a boost and help the government using evidence to time the boosting of people in our country. The main priority for all of us, we heard earlier on from the minister that there are over 60-year-olds who haven't even had their first dose. And so our priority in South Africa is to get everyone at least one dose of the vaccine and then concentrate on the people who got the vaccine early, and particularly the healthcare workers, to make sure that they're protected when they work in the next wave. But we all have to get coverage. And to help our healthcare workers, not only do they have to get vaccinated, but we have to get vaccinated with them to help protect our health system. So everybody has a role to play to protect everybody for the fourth wave. So please go and get vaccinated. I'm going to go and get my booster shot as soon as I can. And I'm planning to do it. And we're very excited to receive our booster shot.
Linda, maybe I'll just add, Foster, if I may, to answer the question of is this removing doses from the national vaccine program? Couldn't agree more with Glenda and with the ministry that our main focus needs to be on ensuring that as many people get their prime vaccination regimen as soon as possible, whether it's 2 doses of Pfizer, 1 dose of J&J, they really need to receive that as soon as possible, particularly our over 60s. And we have to get those numbers up. We're pleased to say that the Sisonke 2 has had a donation of additional vaccines. So the good news is we are not removing any vaccinations from the national program to do this. And so, that I think is also important to note. And then there was a question about the durability vis-a-vis disease and severe and death. And really, we haven't seen any indication as yet that there has been an impact on those two very important endpoints. Where we have seen the waning has, as Glenda has said, been more on the infection side. And what has happened there is that people are having breakthrough infections, but they tend to be mild or even asymptomatic. We have not seen the impact on disease and death as yet. And so I think it is important for us to say, how far can we push our prime vaccine? How far out can we go? Because that's going to be really important for our programs in the future. So I think an exciting time, and I'm just going to add my push that the way for us to protect ourselves best against the fourth wave is to make sure that we get as many people in this country vaccinated as possible, as soon as we can.
Thanks to the two profs for the contributions, inputs that we've made. Before I call upon the Deputy Minister, Dr. Sibongiseni Dhlomo, to do the closure, I want to check with Minister if you have got any last contribution.
Can we give Dr. Moloi? I see Dr. Moloi wants to say something. Can we give him a chance?
Yes. Hi, Doc.
Hi. Yes, thank you, Minister. The point I wanted to stress has been asked that is this vaccine teratogenic? It's very important because there was a clear study which the CSD have done, which looked at the patient who actually have vaccinated and go through pregnancy. Therefore, that vaccine is safe. It cannot cause any teratogenic. For pregnant patients, just to allay their fear, that is very safe. The second thing, the vaccine doesn't cause any miscarriage. Also, that study has been done with a V-safety study of CDC, and a lot of patients were there and look exactly what happened. Just a point I just wanted to stress so that people who are pregnant, they should really take the vaccine.
Thank you very much, Foster. From my side, just to thank all the panelists and give over to the Deputy Minister Dhlomo to do the honors in that regard.
No, thank you very much, Minister. I know you are a man of influence, so I could also up-delegate to you that maybe if we could really have many Vuma weekends, they are very impactful, and we really need as many as we can before maybe we get the fourth wave. So I know you could really influence wherever you are as our minister to get many Vuma weekends. This week, we have another Vuma weekend. Thanks to the two professors, Professor Gray and Professor Gail Becker. Today we are joined by Dr. Molloy. I think if South Africans had any doubt as to what are we doing, they must take solace that this program, this campaign is science-based, is evidence-based. I mean, really, Minister on his own right is a scientist, but of course, changed to be a politician. But he really takes to his time to invite scientists who are currently dealing with these issues to come and advise us. Just the last comments of Professor Beck, I say, please, South Africans, as many as of you possible, come on and vaccinate. And we need to do this as soon as we can before there's also a danger of a fourth wave. So, I mean, that's not coming from the minister. It's coming in from a scientist who's dealing with these issues and seeing the global trend. So please, we need to really give space to that type of advice coming in, not only from government, but also from the leaders who are supporting government in their scientific knowledge. Minister, you tasked me this week to go with Ms. Steve Letsike to address NETLEC. And in that meeting, all trade union leaders who were in there, religious leaders, traditional leaders, and all other civic society leaders were making a commitment to support this vaccine campaign. And thanks to Ms. Letsike for inviting us. They were therefore giving a message to the Department of Health that in their areas of influence, they will do their best to actually support the Vuma campaign this weekend and also beyond. You probably are aware, Minister, that we also need to continue to support the Department of Sports and the Arts and Culture as they are doing the return to play in Gqeberha this weekend. They are also actually talking very strongly on the sports fans. And the Eastern Cape being a very strong rugby province, we hope that the message that came from President Mark Alexander and Joseph Dweba will go a long way towards strengthening that, because we are saying not just the Department of Health, not only the Minister of Health, but all of us collectively as South Africans should do this. It will only be there that we'll see a better Christmas and a better New Year. Thank you very much to all the participants, and thanks to Pauline for I learned today about you are a champion. I would have to learn more. I'll talk about that when I go to other places. Thanks for educating us. Back to you, Foster. Thank you.
Thank you, Honorable Deputy Minister, and go and represent us well in the Eastern Cape together with the Deputy President, the Minister of Sports, Arts and Culture. Minister, before I do the official closure, you want to add anything? Thank you.
No, just to add my thanks to everybody, to yourself, Deputy Minister, and the team. Thank you very much. I think let's all go and mobilize more people to vaccinate on this Vuma weekend. Thank you.
Thank you, Minister, and thanks to the members of the media and general public. Let's go and do the right thing, mobilize people. Thank you. Have a great weekend.
Thank you, Foster.